Hello, Dr. Sarah James from the University of Wisconsin Family Medicine Program. You are now about to watch the video for the pelvic joint mobilization. Hopefully by the end of this technique, you'll have a better idea of how to complete this technique as well as the muscles and joints that are involved. Please enjoy.
You have found an SI restriction that you will treat with a muscle energy joint mobilization technique. This technique can be applied for multiple dysfunctions and will likely affect sacroiliac joints and the pubic symphysis joint, as well as several different muscle groups. Essentially, this will be alternating isometric abduction and adduction. Isometric contraction should require enough force to fully engage the target muscle group, but not so much that the patient compensates with core or lumbar musculature. The patient will be supine, with knees bent, and unshod feet flat on the table at hip width apart. They will keep their feet in this position for the entire technique. Your patient should be comfortable. Stand at the patient's side at knee level. You should be comfortable and not straining your own body. Step 1. Hold your patient's knees together and instruct the patient to pull their knees apart while you resist any motion, creating an isometric contraction for 3 to 5 seconds. Then ask your patient to relax. Place one tight fist between the patient's knees and ask them to squeeze their knees together for isometric contraction again. Ask them to relax. Step 2. Ask your patient to bring their knees to hip width apart. Again, you will provide resistance for isometric abduction for another 3 to 5 seconds. And then ask them to relax. Then put two tight fists end to end between their knees to provide resistance for isometric adduction and subsequent relaxation. Step 3. Knees are then further separated to your forearm width, and you will again provide resistance for abduction with subsequent relaxation. Then provide resistance with your forearm for adduction and subsequent relaxation. Have your patient lift their hips off the table and place their pelvis back down on the table to reset their position. Then recheck your landmarks and dynamic tests to assess for resolution of the somatic dysfunction you identified prior to treatment.